Hi, I'm Linda of Smile Inside Holistic Therapies, and I'm author of my first book, Wake You Wake Up, Rise and Shine, which is my story of how I recovered holistically following my near fatal heart attack and heart failure last year. I basically used all the holistic therapies in my therapy toolkit to bring myself back to full health and not just survive, but to thrive and holistically as possible. Following my video recently about manual lymphatic drainage massage in the legs, especially appropriate during lockdown when we're not able to move around very much, I was asked if I would do a video of manual lymphatic drainage massage for the arms. So this is particularly useful in anybody who's had any breast surgery with cancer, for example, and had any lymph nodes removed, and so that will make it more difficult for the lymph to travel out of the arms and away into the bloodstream and be carried out of the body. Lymphoedema is a collection of lymph in any part of the body, but it can be very painful because it makes that part of the body swell, stretching the skin and so forth. And also it's not very good for health if all of the toxins, waste products, dead skin cells and so forth, if they're trapped in that part of the body, that can lead to infection, cellulitis, which is a very serious complication. And can lead to ulcers. So it's really important to keep the blood and the lymph flowing, and especially if you're sore from surgery and you're not able to move that limb, so in this case the arm, if you're not able to move that around very much, and if you have painful scarring. So let me first of all just read out some contraindications. First of all, it's really important to get your medics okay to do this. In doing so, do let them know that manual lymphatic drainage massage is a very gentle massage. We're not talking some huge burly Swedish masseur here wading in and pummeling you. It's very gentle, and it's important that your medics realise that and appreciate that, okay? So it's always important to get their permission, but a quick email, quick phone call, even WhatsApp, depending on how you communicate with them. Also, if you have any infectious skin problems, don't do this. Don't do any massage. If you have a fever or temperature, because that could spread the infection around the body. If you've had recent surgery, and by recent I mean within the last 6 weeks, for example, because things will still be repairing, and so it's important that you don't dislodge any stitches and stuff like that. So wait for that and you don't want to open up any scars, okay, any surgical scars. If you've had any recent injury or trauma to the area as well, you've got to be very careful. If you have circulatory problems, if you have a history of DVTs, deep vein thrombosis, or thrombosis, embolisms, then do get permission, get the okay from your medic as well. And also if you have serious heart problems. Now, I had heart failure. I had a very serious heart problem. My heart was functioning at 17% when I was admitted to hospital, and they didn't think I'd make it through the night. However, I'm now 11 months down the line. I've been working on myself, taking responsibility for my own well-being and health for that 11 months now, so I feel that I am capable of making that decision for myself. If you have a serious heart problem, what you need to appreciate with massage is it encourages circulation, not just of blood but also of lymph, and in doing that it puts extra strain on the heart. So do get the okay from your medic. If you have a serious heart problem, continue to, and I'm sure they'll be fine, but they might just tell you to just do, like 20 minutes at a time, 10 minutes at a time, which is, and with this kind of massage you can do that. You can adjust it to suit whatever your needs are, okay? So, the benefits of manual lymphatic drainage massage now we've done the scary bit. When you massage using manual lymphatic drainage massage, you shift the lymph 20 times more than the body does naturally if it's in a dormant state, if you're just lounging around, for example. Normally, your lymph will move quite naturally with the movement of your body. So by moving around, by exercising, by walking up the stairs, by having a shower, anything that you do in movement, normally it will work quite effectively. But if you've had lymph nodes removed with cancer treatment, for example, or biopsy, then you're missing some of the important parts of your body that help this happen naturally. Also, being on lockdown, a lot of people aren't moving around very much at the moment, and so our lymph system could do with a little bit of extra help. Lymphatic massage is very good for the skin and tone because you're massaging and shifting toxins and improving circulation to the area, which brings nutrients from food and also liquid in the form of water. So it brings that to the area, helping it to be in very good condition, the limb, the skin and so forth, and your body in general. As I've said, it improves your circulation, so I'm reading my notes here so I don't forget anything. Surgical scars. Massage is actually really good for surgical scars. It helps to reduce adhesions, which is scar tissue. And whilst you want parts of the body to knit together, what you don't need is big lumps in there, which will reduce circulation, reduce the flow of lymph and of blood and energy through the body. So once a scar has totally healed, perhaps 6 weeks or so, your surgeon is the best one to advise you on that, because we all have different capabilities. Then it's a good time to massage, just really gently with a moisturising cream, aloe vera preferably, because aloe vera promotes cell growth and repair. Okay. Massage is very good for the immune system, so it's very good to flush the toxins out, helping your body to repair and to keep your body in a healthy state. It's very good for the nervous system. It's very relaxing, as you'll find out, very detoxing, and it also is very good at reducing pain because it's a gentle touch. It desensitizes the area, and stroking of any area, just stroking as if you were stroking a cat, is a natural analgesic. You think if from when you were a child, or if you have children, if your kid hurts themselves, the first thing you do is you want to kiss the area, yeah, and that's because even that promotes pain relief and skin repair, cell repair. So in massaging, basically you're doing that for yourself here. Okay. So what we're going to do here is a manual lymphatic drainage massage on one arm today. Okay, so you would think that you would start here and work up. Well, you don't, because if you do that, you're flushing anything from here up your arm, and you haven't cleared your arm yet. So the first thing you do is clear the area that you want to massage and clear. So you have to create the pathway. So we do this by working from the armpit here down to the chest, to the thymus, which and the veins there that are going to flush from the lymphatic system into your bloodstream and so out of the body. So we can do this just by stroking. It's that simple, and it's as if you were stroking a cat or a dog. It is really gentle, okay? And then we can do some pumps. So you can see my clavicle there. So we're going to do some pumps there, and that helps as well. And just pump down to the centre, okay? And continue to do that. Magic number is always 3, I always find. So pump, pump, pump. And if any areas are tender, then that's a clear sign that the area is blocked. Once you've pumped, then sweep again and clear that area. Okay. So now if we go into the armpit itself, okay. So with the armpit, we're going to move around in little circles here. So move at the furthest point away from your midline, because you're moving everything towards your midline, towards here. So just little circles like so, okay? Right. And you can do this for a few minutes, okay? You don't have to rush when you're doing this. See, I'm a bit tender there actually, which is interesting. So I'm going to massage that for a little bit. Okay. If you feel any lumps, and you haven't had lumps previous, and you feel any lumps while you're doing this, get them checked out just to be on the safe side. It could be cysts, it could be a blocked pore with some gunk in there. Charming, eh? Lovely bodies. They're they're lovely bodies. Keep us alive. But you know, so don't freak out, don't panic if you find a lump that you weren't expecting. Okay, I've got a lump in this armpit, which was from cutting it with a razor when I first started shaving many years ago, and so I've got a little lump there, but it's been there since I was about 16, 17, so you know, it's nothing for me to worry about. Okay, so just doing little movements like so, and then sweeping in, sweeping in, sweeping into the midline, sweeping into the midline. Now, you don't have to be precise here because you're encouraging your body to do what it does naturally. Okay, so you can see now I'm just doing a bit of pumping there. Okay, if it really hurts, don't do it, or avoid that area, or just work ever so gently around the area rather than over the top of the area. Okay, so that's a really good tip there. Okay, so I'm going to sweep that back in. Okay, and then we're going to move on to the upper arm. Now, have a cushion or something handy and a tabletop, like I've got my elbow rested on here. Don't stress your body. Do it naturally, do it kindly, be kind to yourself, you know. So, like I say, I'm not going to go crazy here, and I've got my, we don't need to be too precise. So what we'll do here, just pump, and I'm squeezing with my fingers on the underside of my arm and my thumb on the top. Already I can feel that's really relaxing because it's stimulating the nervous system with nice relaxy endorphins. Okay, and then underneath, but squeezing either side. Okay, and you're working from your elbow up to your armpit, and then a nice gentle sweeping motion like so, and on the top like so. It's really gentle, really nice. And we'll repeat that. So we can do the sides from the elbow up to the armpit. Again, 3 the magic number. I've discovered a little sore bit there. So when you feel a sore bit, as long as there's no bruise or anything there or injury, you can work that for a little bit longer with a nice gentle circular motion with your thumb. And squeeze up. Don't expect everything to shift in one day. It will take a few sessions of this, okay? And similarly, if you've got any sore points, blocked nodes and so forth, don't expect that to disappear overnight. It will take a few sessions if you're doing this. But obviously I've been talking quite a lot, so you can do this. Just take 10 minutes while you're watching TV. That's what I do, and do it. So you see now I've moved onto my lower arm and my bicep. Okay, bicep and tricep. And so then we're going to do some strokes. 3, and underside 1, 2, 3. And you can see how I'm supporting my arm here on that cushion. And a few more pumps like so. Pumps like so. I'm going to mix it up a little bit here. So, just so that you can see, and doing nice circular motions, moulding your hand to the shape of your arm. Okay, do a little sweep down and do it on the outside of the arm, so you can turn your arm over if you'd rather, and work from the elbow up and sweep it in. Okay, so this is for you, and remember that you're not doing this to pass any exams or anything. You're doing this just to make sure that your circulation is working effectively and to give your lymphatic system a little bit of a help. Now I've started using the heel of my hand here because it's easier than stretching around. So just doing a nice circular motion like so. Okay, and then you can just sweep up and in, and sweep up and in, and sweep up and in. And let's do some more circular motions. So don't be afraid to move your arm around. Always work within your body's own abilities. Don't hurt yourself when you're doing this, okay? Move your arm around. And like so with the heel. Okay. And like so. And at this point you can then work that axilla again. Okay, just nice sweeping motions. Move that in to here, to the centre line. Sweep down your arm. Go with the flow, literally. Okay. Okay. And with your elbow, just nice circular motions around the tip of your elbow like that. Your funny bone. It's not very funny when you bang it though, is it? Okay. Go backwards and forwards a few times. just to get the circulation going. And then we can go on to the forearm, okay? And with the forearm, same technique really. So start by preparing the area by sweeping. Okay, and you can just do the back as well. Okay, and you can do nice circular motions. Hope you can see that all right. The nice circular motions up to your elbow, and then on the side of your arm, on the back of your arm, just up to the elbow, on the other side of your arm, sweeping down. And this time when you sweep, we'll sweep all the way up and to the centre, all the way up and to the centre, all the way up and to the centre. And then we'll do a few pumps here. So you can use your fingertips, you can use your thumbs, use whatever works for you. Again, you don't need to be rough with this, you don't need to go deep. You're just doing what your body does naturally, but you're giving it a little bit of a helping hand. And then plunge the crook of your elbow here, and then sweep. And again, one. Now be very careful. Another contraindication is osteoporosis. Now with osteoporosis, because this is such a gentle massage, you should be absolutely fine, okay? That is something to check with your medic, of course. Big, deep, proper Swedish massage, that's not a good idea when you've got osteoporosis, especially if it's advanced osteoporosis. But having said that, low impact exercise is good for your bones, because it encourages bone to be put down into the bones to create them, make them stronger again. So you see, what I'm doing here is this. It's pumping in and sweeping, and up and in, and up and in, up and in. Okay, right, and turn your arm like so. And then if you want to move on to your hand, you can just do some nice circular movements on your palm. If your fingers are feeling stiff and sore, this massage is a natural analgesic, which means it's a natural painkiller. So you'll find that by doing massage, endorphins will start going around your body. See what I'm doing here? Just doing this movement. Okay, it's so relaxing, it's lovely. And do that all over your palm, just to encourage the circulation. Okay, and if you want to, then take that up. This is for you, don't forget, so do what comes naturally. Okay, and then you can, if you want to, do each of your fingers. If you've got problems with swollen fingers, a good one to do is to, I'll do it around this way, I think. There, 1, 2, 3, and just sweep down. Just sweep down your fingertips. Sweep down. It's really weird not wearing my usual green nail varnish. I'm never seen in public without my nail varnish, but because we're on lockdown, I'm giving my hands, my fingers, my fingernails and my toenails a break, because no one's here to see them. Okay, so one final thing I would say here, and we're doing it to the heart. Okay, so like so, the clavicle. Okay, now if you're prone to anxiety, which can be a side effect of cancer treatments, for example, or just in general with lockdown and everything, it's quite a peculiar time right now. If you put your hand here with your thumb just where your two collarbones join together, and here, rest your hand there, where your fingertips are, pump that, and that's an acupressure point for your heart. So if you have heart problems, that's a really lovely one to do, really nice and gently, and just do that a few times a day anyway. And this will encourage the lymph down, but it will also encourage your heart, the heart muscle. My acupuncturist, who's an absolute godsend to me when I came out of hospital after heart failure, and he advised me to do some chest beating on this area to repair my heart muscle, which I did. Okay, so once you've done one arm, it's always a good idea to do the other arm as well. Even if you've got all of your lymph nodes are intact there, then it's still a good idea to just from a balanced perspective. Okay, and I think that's all I wanted to say to you today. I'm just having a quick skim through my notes to see if there's anything else. and I think I've covered everything that I wanted to say today. So enjoy. Any comments, please put them on the YouTube and or on the posts where you see this, and do share it. And namaste. Thank you for watching, and I hope it helps. Let me know.